I'm Dr. Matthew Ragsdell, and I'm a DO. A DO, these days, it's more similar to MD than it was in the early days, but we started out around right after the Civil War, and Dr. Andrew Still started in Kirksville, Missouri, and they started doing really some manipulation and different things. They were big on helping flu victims early on. And as it grew through the years, they've continued to learn the manipulatory techniques where they we learn a lot of manipulation during DO medical school. But then as it's transitioned, it's become the same training as MDs get, plus some of that manipulation. I originally from Indiana. Growing up, my dad was an engineering professor, and we ended up at the University of Missouri in Columbia, and I ended up going to med school in Kansas City. And going to the DO school there, which is the second oldest one, been around since 1917. And then ended up in last 2 years of med school rotations in Detroit, and did my internship, my residency, and my fellowship. Spent 8 years in Detroit area doing all of my specialty training. You know, when I was in high school, I played football, and I was an All-American football player in high school, and I used to always hate it when I would hurt somebody, and I always wanted to know how to fix them. And there was a really nice, good orthopedic surgeon that took care of our football team in high school, and he really inspired me to look into that as a career. And I was very fortunate. I knew what I wanted to do: sports medicine, orthopedic surgery, from the time I was a junior in high school. I'm married. My wife Cassie is here and just sending me pictures of the beautiful waterfront just a few minutes ago. That was one of the main things that attracted us, start looking in Florida. We have a soon-to-be 8-year-old son, Isaac. You know, we started a search that was really nationwide. We were very focused on Florida because we would end up spending almost all of our vacations here. Just coming down and going fishing, spending time on the ocean, and through some connections we knew of Center for Bone and Joint Disease and how well managed they were, and we got set up through, it's amazing how small of a world it is. We got set up from a friend who knew Dina, the practice manager, and that started us talking to Center for Bone and Joint Disease, and when we came down in our interview, we really knew it was a perfect fit. If you can meet a patient when they're at one of their worst spots in their life, anybody who's had a fracture or a broken bone knows that that's one of the most painful moments of their life. They oftentimes have a lot of fear about being able to walk or just do their daily activities again. To be able to see them go from that state to getting their pain under control with the right surgery, to get them through therapy and see them participate in what they love to do again, that gives us a great deal of satisfaction. I try to take my patients through a range of options, and I try to start my list with non-operative things. And we try to work our way up that and not get to surgery unless they really need it. My focus in knee and shoulder is to try to get a patient's inflammation and pain under control. If sometimes an anti-inflammatory medication, sometimes an injection in their shoulder can accomplish that, combined with physical therapy, and if that's helping their problem, that's the goal, is to get there without surgery. When that's not helping their problem and they have a definite tear that's not going to be fixed just with a shot or physical therapy, that's where we move on to talking about our surgical options. Sports medicine crosses all ages. We'll see children who've hurt their elbow in gymnastics all the way through the college football player, and all the way through the husband and wife that are out trying to enjoy a game of golf and their shoulders hurting them, their knees hurting them, and they've got sometimes small issues that can be treated non-operatively, and that's the majority of what we do in sports medicine is non-operative treatment. One of the options that we have with people having knee pain, oftentimes they have arthritis, but they're not at the level that they need a knee replacement. We're able to offer them, besides just your standard cortisone shot, different levels and types of injections. One is viscosupplementation, which is a big word for gel shot, or it'll also be termed synovial replacement, synovial fluid replacement in the knee. And that really gives people a lot of relief without surgery. The other type of injection we're offering is PRP. Most people have heard of PRP at this point. That's where we actually have to draw your blood, and we spin that down and put your own growth factors back into your knee to help heal your knee. But my experience so far has been really positive at Center for Bone and Joint Disease. from the staff that work here to the patients, hearing about the reputation of Center for Bone and Joint Disease, which has really been earned through the years here. It's been a pleasant experience getting started, meeting people. I've found the area to have very friendly people, and I've enjoyed it immensely. Yeah.